Today, we're tackling this as part 3 of our webinar series on caring for aging loved ones. Today, once again, for those that have not met or listened to this before, my name is Chris Thomas. My firm is 40W Advisors. We are a independent boutique wealth management firm, and I'm joined by Fern Pessin. Hello, Fern.
Hi, glad to be back.
Yes, back for round 3. We're glad you came back. So, so Fern is a caregiving expert. She's written a couple of books on this topic, and the book "I'll Be Right There" is a resource that we use with clients, and something that can be a great resource for a lot of folks. So. I don't know, Fern, you go a little bit more into your background for those that maybe haven't joined us in the first 2. So why don't you just go ahead and explain your story a little more, Fern?
Well, I'm from the Northeast, and I've lived in Boston and New York and Connecticut, in that area. And in all that time, I was always working with senior organizations and caregiver groups and Alzheimer's people and all of that. And then Dad gets diagnosed with Alzheimer's, and I moved to Florida to help my mom take care of him through as it was getting worse. We had a lot of decisions to make and a lot of lessons to learn, and people kept saying, how do you know all this stuff? So I put it into a book, and now my mission is to help other people make this as easy as possible and reduce stress. Met Chris and Sophia, and we've been working on doing that. So right. Here we are.
Yeah, perfect. And as I mentioned, our firm, 40W Advisors, we're a wealth management firm. We tackled this topic because we were dealing with it with a lot of clients. We're actually dealing with it in our personal lives as well here at the office. But caring for an aging loved one, whether it's a parent, a sibling, aunt, uncle, it can be a stressful time, and it can be financially concerning. And at the time, or for a lot of us, where you're in your prime working years. So it's a time where maybe you have children of your own, prime time of your career, earning potential, and all. And now all of a sudden, there's another element of your life that takes up a lot of your bandwidth. So we, in helping some of our clients deal with this, not only from the administrative and emotional side of it, but also very in line with what we do on the financial side of it. So our slogan for our firm is more time, less stress. That's what we try to bring to our clients in their financial lives. And again, this topic just, it just kept coming at us with, again, our own lives and our client lives, that we decided it was something we needed to address. There was a need out there. So we went through and set up this workshop that I hope you found to be successful. And we've taken it a step farther. We've actually, engaged Fern and her services to work with our clients who are going through this. Our personal wealth management clients are able to work directly with Fern, and she can help facilitate discussions with the family, and also just help them, do the research, a lot of which we're going to talk about today. So getting to what we're talking about today, here's the agenda. We're gonna tackle this in 3 segments. Fern's going to go, heavy on the first 2, and I'll talk more on the financial side in the 3rd section here. We're going to talk about kind of identifying what care is needed. And then we're going to talk about just assessing those different options. A lot of you may be familiar with, nursing homes, assisted living facilities, adult daycare, home health care, aides, nurses. What's the difference between all these things? So we're going to talk about that. So I'll go ahead and we'll jump in with this first segment here, where we're going to Fern's going to talk to us about how to really identify what's needed in your specific situation. So Fern, I will turn it over to you.
Thanks. So the first thing that any of us need to answer the question of what is it that we need, right? So doing an assessment of your loved one's situation, whether it's the spouse and you're already in the house and you're looking at everything, or whether it's, as Chris said, parents, siblings, close friend, cousins, whatever it is, taking a look around. There's 3 different areas you want to look at. You want to look at their home, you want to look at their emotional and physical well-being, and you want to look at the sort of logistical kinds of things. So we're going to go through a little bit of that. The home life assessment is it safe to stay in the home? So there's two parts. One is, do they know how to use things in the home? I know, finding the remote in the refrigerator, or my father blew up eggs and it was on the ceiling in the kitchen. Is the home a place that people are going to be secure and able to deal with whatever's coming up with their physical and mental well-being? So household tools, maintenance, looking at the logistics of things like bathrooms and bedrooms and moving from one part of the home to the other, how wide are the hallways, all of those things. So this is the first slide about home life assessment, whether they can leave their home safely and drive when come back to the home and so on. Then they're looking at the safety in terms of fire, in terms of food safety, or things moldy in the refrigerator, are the doors secured and locked, and things like that. If somebody is diabetic or has epilepsy or something, are they safe in their home alone? Is there anything to watch over them, anyone to watch over them? Chris, next one, please. And then there's the health status. So when, as I just mentioned, diabetes, when people have different things going on, it's not sort of the normal thing. My father was always, I'm okay, I'm strong, I'm healthy, I'm all of this, but his mental capacity was going. And I had a client who was a financial planner in Florida. Her sister was in the Lower Virginia area, and their mother was in the Maryland sort of borderline, and their mother had diabetes, and they were trying to make a decision on what to do, and they wanted to move their mom out of the home, and she refused to go. So we came up with an idea of a dog that can identify diabetes and let the neighbor know that there's a problem and give the mom a reason to go out and exercise. And that was the solution there. So looking at the health status, looking at what people experience every day, is the home okay there, or do people need help? Do they need more help than they currently have? Chris, any thoughts?
Yeah, what I was going to say, as we were prepping for this, something to remember is you're just going to see a lot of bullet points. There's a lot of lists as we go through this. And that's just because what we're trying to do here is to give you things to think about, and every situation is very unique. And that's why I mentioned Fern's book earlier. It's how many pages is this thing?
It's 352 pages.
Yeah, so it's over 300 pages, and a lot of it is checklists and things that are just ways for you to go, saying, where do I start? And as we go through today's presentation, we're starting with the premise that a lot of people want to stay at their home. Mom, dad, whoever, a lot of times we want to stay in place and stay at the home. So as Fern just covered, well, okay, but is the home safe enough? Are there safety hazards that might mean they need to leave the home? Are there, do they need to have someone in full time to monitor deteriorating health conditions? These are things that, like you said with diabetes, blood sugar spikes can, someone's got to be alert to that. So does that mean there needs to be someone there full time? Or it sounds like you found a great solution with this dog. That's kind of amazing. So
yeah, and there are ways, and we can get into that, but also if anyone wants to talk to me, I'm happy to talk about your specifics. It's there, we put a camera in the house, just in the living room, not in the bathroom or the bedroom, because we're the kids, we don't need to see someone. But for spouses, having a camera at home allows someone to go out and know that they can still keep an eye on their husband or wife. And so there's a lot of different solutions. But once you get past the physical, once you get past the health issues and illnesses and all of that, you also have emotional and mental wellness. So if somebody is living alone, there's a whole different change. If they're used to living with somebody all their life and suddenly they're alone, there can be a sort of a fake liveliness. So when you get on the phone with them, they sound great and they sound really together. But when you're not on the phone, they could be really withdrawing from society, not going out of the house, not being social anymore. And it's hard to know that when you only talk to them on FaceTime, for example. And so I think that monitoring and looking at this and evaluating all of this is important. And there's a bunch of things in here, and each one of them could be something that triggers a reason. Maybe they should be in a place with more socialization. Maybe they should have daily activities with other, or a couple of times a week. Maybe they should come visit me more often. So decisions are what we're talking about. You're doing an assessment to make the decisions about what might be best with your family and your loved ones.
Yep.
So what are the options, right? What are my choices here? And all I want to say, and I always say this, and Chris knows I get sick of hearing this, but it's always about, people say, well, that doesn't happen. My father's not going to fall. My mother is strong, whatever. But meanwhile, my dad called me after he fell on the terrace and was on the floor in the terrace because he couldn't remember how to get up. And he wanted me to train him on that. So it doesn't happen until it does. And you thinking about this now before there's a situation and planning for it is going to save you a lot of headaches and potentially a lot of money in the future. Preparing, sorry, I have a little bit of a frog in my throat here. Preparing for the financials of whatever it is you're going to want as your next step is where, Chris excels. And I'm not that great at that, but I can tell you what to look for and how to get there.
Yeah, I think that part of the advanced preparation too is having conversations. And that may even be the next slide. So having conversations with with your loved one before they're in a deteriorated state, mentally or physically. I mean, think about it. I mean, going through the process of aging, even just a little physical deterioration for somebody that's used to being active their entire life can lead to a pretty quick negative mental state where now they may not be willing to have certain conversations. So so much of this is conversations, and that's what we focused on, in our first webinar series. Our first webinar was entirely dedicated to having conversations, but it's worth reiterating here that planning ahead of time, having a conversation about what type of facility mom, dad, or whoever might want to be in. Or forget about facility. Where would you like? What would you like to have happened? We talked about needs for a few minutes before, just that you can help assess what needs they have. But then there's the conversation about what do you want? And I think it's easy to have those conversations. It's easier to have those conversations before you're in a state of stress.
Right, and just an FYI, I've talked about it in the previous ones, but my parents did not agree. Once we started having this conversation, it was like, you want to go where? You want to do what? And they were talking to each other, and I was listening to try to be of service to them. I always say it's not about what is best for me, although certainly reducing my stress was on my mind. It was about what is it that they want. So having the conversation to find out, how do you want to live your life? What is important to you? What are the things that I can help you be sure to have in your life ongoing, going forward? And if you have those conversations while everybody's well, it's a nice conversation. If you're waiting until somebody breaks a hip, you have a different kind of conversation. It's like, you don't have a choice right now. We need to send you somewhere where you can have rehab. We need to send you somewhere where you can have somebody watch over you. If somebody can't get to the bathroom on their own, those are things that happen later. So having the conversation early in a way to prevent those things is really important. And then the options are, I want to stay at home or I want to go somewhere and have help. So the at-home living with family is an option. Everyone, I work with a lawyer, said everyone says they're going to go live with their children, and the children are all shaking their head going, no, they're not coming here.
Right.
And I have a friend who is in Santa Barbara, And her daughter was like crazy busy with work. And she said, Mom, I could really, I'd love to spend more time with you. Her daughter was in Oakland, California. So she moved from Santa Barbara up to Oakland into her daughter's huge house. Her daughter was really successful. And it's a long story, but in essence, what she did was she wound up becoming the maid. I mean, she was keeping the house clean. She was cooking food for her daughter. Her daughter would come home, have a drink, eat dinner, and then say good night and walk out of the room. And she said, I don't need this. I had my own life. I had my own friends, and now I'm separated, and this isn't what I wanted. So living with family isn't always the ideal situation, and bouncing around from child to child is not necessarily a good situation either. So those are options people consider, but you really want to look at what is in the best interest of everybody. And then to move out of the house, you have a bunch of options. You have independent living, which is kind of like living on your own. You're basically in an apartment, but someone else is cooking. Someone else is taking care of the cleaning. You don't have any utility bills. You don't have to do maintenance on the house. It's like sort of a freedom. And my father said, I'm saving money. Mom's not shopping. And so it turned out to be a better option, independent living. 55 plus, I know a lot about because I had just moved into one. And people were asking me when I came, are you here for your mother? I'm like, no, I'm here for me. I need this. And
Or they let you in and you're only 49 and they let you in. That was really nice.
Yeah. Sure. Thank you, Chris. So I got a call 2 days ago. I was pet sitting for a client, and I got a call from this woman, Linda, who lives in the building. I said, is Jerry okay, or everything okay? She goes, yeah, we just haven't seen you around. We were worried. Are you okay? Do you need anything? I was like, oh my God. That is so cool. I don't live with anyone. I don't have anyone looking over my shoulder, but there's someone who cares about me. So, and there's activities. There's happy hours on Thursday nights. Woo! There's exercise classes. I'm in a book club, and all of these things are just in my community, and I love it. But I have my own kitchen. I have my own house. I make my own schedule. I'm not required to be in a dining room at a specific time. Assisted living is for people who need a little bit more care. And then you go into memory care, and you go into skilled nursing, and you go into hospice. And we're going to talk a little bit about those.
We've got a little bit of information about each of these. So maybe we just briefly go through some of these different care settings. I think you've laid it out well here, just kind of explaining what they are and some things to consider. By the way, just from an administrative standpoint, this presentation will be recorded, and the deck here will be available to you afterwards. If you have questions or chat or have any comments, you can use the questions box or the chat box, and we'll get to that. I forgot to mention that in the outset, so I wanted to just quickly throw that in there. Proceed.
Yeah. So the only thing, I mean, you guys probably know most of this stuff, but the adult daycare is an option people are not aware of. And that is if you have people who are coming to stay in your home, but they need socialization and you're busy running around and everything, adult daycare is a good option. It's basically people go somewhere and there's activities, there's card games, there's movies, there's food being served. And so that's an option. And also if someone is staying at home but needs socialization, they live by themselves, go into adult daycare is great. And usually they have bus service to take you to and from. So I just wanted to point that out in case people are not aware of that. All the other options for staying at home with care are listed here. And the thing that you want to be careful about is if somebody is staying at home, think about if you're the caregiver, how much fatigue does that bring you of having to watch and know somebody is by themselves in a home or a couple is there on their own, and you have to worry about it more if they don't have help. So think about that. Okay.
Yeah, we're going to talk later about the difference in cost and services from an aide versus a skilled nurse too. So we'll get more into that when we get into the financial piece in a few minutes.
Excellent. So like I just told you about the 55 plus where I am, and you have all of these great amenities. But if somebody is having trouble with cooking, or you're worried about, fires from people cooking and leaving things on the stove, things like that, that's not included in this type of community. It's an option for somebody who's really able to live completely independently but needs socialization. Living with family, I also talked a little bit about, and people love it because they think that they're going to be part of holidays and milestones, and that is true. They feel like they're going to be helpful, but maybe that isn't always true. So people can become lonely even in a family situation. So really consider all of the characters that are part of the household before making that decision. Independent living, I think we're all doing that. So we all kind of know what that is. But an independent living building, and we're going to talk about aging in place, an independent living option now adds in food, housekeeping, utilities, medical visits, doctors on staff, things like that. So that's an option with independent.
So it's where you move into a place full time and kind of transition through the different levels of care that you might need. So like you said, we'll talk more about that in a bit.
And the thing is, when somebody lives at home and stays at home or moves into independent living, for example, my dad had Alzheimer's and we moved him into independent living with my mom, who used all the socialization stuff, but dad didn't want that. And as his Alzheimer's got worse, it was actually less expensive. We'll talk about money later, but it was less expensive to have the aides and nurses coming to him in his independent living apartment than it was to move into assisted. So we're going to talk about the process for evaluating everything, but that's something just to keep in mind. So you can go anywhere from a companion who comes and plays cards with you, all the way to nurses who make sure you get to and from the bathroom and have your injections and have your pills and everything. So those are additional options when you're independent. Then in a community-based setting,
Now we're switching gears from staying at the home to going towards more of the different types of facilities where someone might be able to move into.
Thank you, Chris. So in these types of communal living settings, you have medical support usually. And the big thing I want to point out here is the tax deduction. When my parents were living in independent living, the whole amount we paid was just coming out of their savings. But in assisted living, we're able to deduct 29% of the cost of their monthly maintenance, their monthly fee, as a tax deduction for medical expenses. So Chris is going to be really good at telling you how that impacts your income and your savings and your future residuals and whatever. But this is just something that people don't realize, and that's something to consider when you're trying to choose between, well, I'm independent. Yeah, but you save 30% if you go into assisted. So you can be quasi-independent and assisted also. Okay.
Oh.
Okay, which is assist, wrong
direction. There we go.
There we go. So assisted living, one of the things my dad hated was, I don't want to be in a place where the people in walkers and wheelchairs all the time. And soon after he got there, he was using a cane. So, you know, you just get used to it. And people park, there's a parking lot, you know, for the scooters and everything. But the people are they're still able to communicate. They're still able to be lively. They just have some physical challenges, and we all have that stuff. So I think just look at it more as I feel like it's a reflection on how well I'm doing if I'm in this kind of a place, and think of it as, how do I want to live day to day? What do I want in my daily life? And Chris talks about what do I want and what do I need? And those are two separate things, but the what do I want is what makes the difference between happiness and loneliness, you know, and I think those are important things. Okay. Memory care is often attached to an assisted or independent living, or it's attached to a place where there's skilled nursing, so that you can have two people, a couple, maybe parents, one could be in memory care, one can be in independent, and they could visit each, you know, the one who's independent can visit. So where the memory care is important. And if it's a solo person, having the attached doesn't really matter. But the care level in memory care, what I want to make sure people understand is, if your loved one needs persistent and constant attention, cannot be alone, need someone to get them in and out of what they call transferring in and out of bed to a chair, in a wheelchair, needs to be fed. You can't go to memory care. That's not an option.
Yeah.
You need to go to skilled nursing for that. So just understand that there are restrictions on each of these, and understanding, doing the assessment of knowing what your family needs and wants is going to help you figure out what these things are. Skilled nursing is the one with the hands-on support. That's for people who spend a lot of time, unfortunately, in bed and need assistance. Often people are having help going to the bathroom, or they're catheterized. The medical team is on site in case there's a seizure or something like that, where you need somebody always there. There's medication management for everyone on site, and so on. These are difficult decisions to make, and it's hard for a family to do that. But the next is residential hospice. You can do hospice at independent living. You can do hospice in somebody's home, but you can also do residential hospice. And hospice in residential, usually you have to have a diagnosis from a doctor that says you have less than 6 months to live. And the big thing to understand about hospice is that it's about palliative care. It is keeping you comfortable. If you have something going on, my friend Rosemary just went in the hospital. She has a glioblastoma. I've talked about her before. She has a rash all over her body, and she has pustules on her back, and the hospital wouldn't take care of her because she was hospice. And they said that she's comfortable, she's not in pain, she can go home. And everybody's screaming, what? It's palliative care versus curative. So make sure you understand and talk to all your physicians and support people to understand before you put somebody on hospice. Chris, did I explain that enough?
You did. No, I think you did a great job.
Okay. And then the most fun. I love these people in this picture. So because that's how I want to be until I in my box. I want to look like this. So the age in place community is what is called continuing care. So you can move from independent status to assisted status to memory to skilled nursing, whatever you need, in one place. Most people move in when they're like this, when they're lively and they're vibrant and they are selling a house somewhere and they need the tax benefits, like I need to move to somewhere else, and if I just put it in savings, all of that logistical stuff comes up, but you can use it to put a down payment, and basically you buy into one of these communities, and then your rent never goes up. I mean, it goes up a little bit, but it doesn't go up. Like the difference between independent living could be going from $4,000 a month to skilled nursing is up to $12,000 a month in major cities. So when you have that difference, if you don't have long-term care insurance, which Chris is the big expert on that, if you don't have that, then you need a place where you can move from level to level. And if you have a couple, that they can see each other, move from level to level without having that big bump in expense, because otherwise you're self-financing.
Yeah, so now we're starting to transition into finances, right? So now, look, we're going to run a little over today, probably 15 minutes over. I think we said 30 minutes for this. It's probably going to go over a little bit, but now we're going to switch. We just talked about how, Fern gave us some ideas on how to identify what's needed, what's wanted, and then to assess based on that standpoint what your, what care setting might be the most appropriate for your loved one. Now we're going to take those needs, wants in that care setting and try to talk about the financial side of it, because at the end of the day, that is a constraint for a lot of people, or a concern. Regardless, I will say I've noticed this, regardless of the amount of money that clients have, there is always a concern or stress about the cost of care, whether it's coming from the kids or coming from the parents themselves that might be the ones in care. So we'll talk a little bit about that, the factors that determine the cost. Fern alluded to it, geographic location, a major, a care facility in a major US city is going to be more expensive than one that's in a potentially more rural area. the level of care that you need based on your healthcare condition. And then the aging in place with multiple levels of care, those facilities range quite a bit in how much you have to pay up front to get in. We didn't talk that you pay up front to get in, and then how much the ongoing expenses are. And then you get into the amenities, that are available at the facilities. So here's some actual data that was provided. I refer a lot to Genworth. Genworth is an insurance company that was a big player in the long-term care insurance world, and they do a cost of care study every single year. And what they do is they look at the cost of care in different facilities, different types of facilities, and across different parts of the world. So I encourage you to you can just Google Genworth cost of care survey. It's the first thing that comes up. And they have an interactive map of the US where you can click into your local area and you can see what the cost of care is in your area. What we show here is just what that median cost is on a national level. And you can look at the home-based settings, staying in the home, if you need kind of that, hands-on help getting around the house or what have you, that's about $33 an hour. A full-time aide in the house is going to be $75,000 a year. And we've seen a dramatic, I think it's worth noting, is why I put it in there, that you've seen a dramatic increase in the cost for those services. And it just has to do with, finding people, staffing, finding the care providers. It's a shortage of care providers, and, wages going up along with inflation for that. So homemaker services, so it's a little more just helping out with around the house, helping maintain the house. That could be provided by, someone providing those homemaker services. That's a little bit less, but still, close to $70,000 a year. And then you get into the facilities. And, an assisted living facility where you're not receiving that, 24-hour around the clock care, about $65,000 a year. And then again, that varies widely based on the geographic region of where you're going to be. And then the skilled nursing homes, you can have a skilled nursing facility where you share a room. So a semi-private room is going to be less costly than a private room. But for those on a national level, you're looking at, over $100,000. Now, I'll pause here. Go ahead, Fern.
Yeah, you can also, you can look at a combination of these. So you can have people who are living together in assisted living where only one person needs the assisted care and the other person is independent. So the add-on for that, you have to remember, this is only for one person. So if you have a couple, you have to do the add-on for what the second person expenses would be.
Right. And something else to point out here too is that typically, outside of conditions like Alzheimer's or dementia, where physically somebody may still be fully capable, but mentally needs to have round-the-clock care. Parkinson's would be on the other side, where physically somebody may need some assistance round the clock, but mentally doing okay. Those are conditions where people can live with those conditions and require pretty intensive skilled care for several years, decades. That's kind of a worst case scenario when we talk about financially, the highest cost of needing this care for a long period of time. And those are two conditions that are kind of where you can see that. But more typically, I should say, is situations where you're really, the average stay in a skilled nursing facility, unfortunately, is, less than 1 year on average. Usually it's kind of a continuum of care where somebody maybe stays in their home and then they transition to assisted living or they transition to skilled nursing. And statistically speaking, that's usually about a 3-year process that someone on average spends in, needing some sort of care. Also statistically, and this is all in the Genworth study, women have about two-thirds of women over the age of 65 are going to need some form of care at some point in their life, where men tend to be statistically will need it a little bit less. So just some things to think about as we kind of dive into the financial sides of it. Fern, I know you want to talk a little bit about some of the costs that are specific to the home, just as a reminder to people when budgeting for this.
Yeah, when you're doing that assessment on the home and looking at all the things that you're going to have to maybe fix it to stay in the home, whether that's access to wide enough everything for wheelchairs to get through or a scooter to get through. Is there a turning lane to turn around in the house? Getting into a bathroom, a shower with if there's a tub, coming in the front door, if there are a lot of steps, all of those things are the home modifications for safety. And then all the various expenses, I joked about it earlier, you don't have to worry about maintenance anymore. You don't have to worry about food preparation. You don't have to worry about taxes, property taxes, that is, if you move to a place that has all of that included in the expenses. So when you look at what it actually costs you to be at home versus what it costs you to pay someone else a monthly fee, it often surprises people at how close those numbers are.
Yeah, and then we talked about the amenities. So you got the needs and the wants, right? Having those conversations with your loved one about what it is they want to have in a place where they live. There's a long list here of, swimming pools, fitness centers. Do they want to have access to, a synagogue, a church, so they can continue attending services regularly? Everyone's unique. Having those conversations is important. And then to the degree that you can find those amenities that are going to make your loved one happy, that's probably part of your job in helping them out. And
right. I'm sorry.
As you add on these amenities, though, these amenities can add to the overall cost of care just based on what the actual, what the facilities offer.
Yeah. So what I did, which you'll see in a second, is I created once I figured out what people want, you go through and you make a chart. And the previous slide that you will get when you get these slides has a list of what you should put in the chart. But this is a sample chart that I did, which gave me, if you look across the top, I just labeled them by city here so that you could see that. But obviously I put the name in and then all the contact information so that I can look at it. And then I was able to compare. So for my father, for example, he did not want to have to wear a dinner jacket to dinner. He did not want to have to wear a tie. And in Florida, a lot of the places require you to get dressed for dinner. And that was the thing that was very important to him. So what is important? This is what Chris is talking about. What are your needs and what are your wants? Is somebody doing your laundry important, or do you want a washer and dryer in your space? Those kinds of questions seem irrelevant to some degree, but when you finally move into a place, all of a sudden they become really relevant. So make those lists and figure that out before you start looking, and then you can just make calls and eliminate places that don't have the things that you need and want, and that narrows your selection down and helps making the decision easier. Does that make sense?
Perfect. Yeah, it's perfect. I think, again, just to reiterate, a lot of those tools and worksheets and checklists and everything are in the book. If you want a copy of the book, just let us know, and we can get you one. So now I want to wrap up with, okay, we've gone through the process. Now, how do we actually pay for this? What are some of the financial strategies and considerations? So when we look at the options for how to pay for long-term care services, we're going to talk about these four. We're going to talk about Medicaid, very briefly, Medicare, long-term care insurance, and personal assets. One of the things I didn't put on here, which maybe should have, and it could be a follow-up, would be veterans. If you have access to veterans benefits, there's VA hospitals, there's VA benefits that can help pay for some of the stuff, and even some very specific VA facilities that can be difficult to get into, but are available if you're eligible for that. But getting into these kind of main four, start with Medicaid. Look, we're not going to go into detail on Medicaid here. Medicaid is it's for low-income individuals and families. If you have over a certain amount of income coming in, you are not eligible. If you have over a certain amount of assets, which could include your primary residence, then you're also not eligible. Medicaid is a joint program between federal government and state governments, and the qualifications vary based on the state where you live. Okay, so One of the reasons why we're not going into a lot of it is because the rules are different for all 50 states. But what is consistent is it's only for low-income individuals and families. About 20% of Americans qualify for Medicaid. So if you or your loved one may be eligible for that, it could be worth looking into. And again, there's state resources for wherever you live that you can get more information.
Just one more thing, in Medicaid, there is an option, if you talk with a lawyer, there's an option to separate two people legally, so that one person could be on Medicaid and the other person holds on to the assets of the marriage. So you can check with your lawyer on that.
Yeah, and it just has to be done well in advance too. So, Medicaid, Medicare, often they get confused with each other. But as I mentioned, Medicaid is, for specific financial qualifications. Medicare is something that everybody is eligible for. But when it comes to long-term care services, which is what we're focusing on here, Medicare will only cover the first 100 days. And specifically, there's also a qualification criteria that Medicare requires a 3-day prior hospital stay in order for you to be eligible for Medicare to cover anything. And once Medicare is covering something, Medicare's only covering skilled or rehabilitative services. Okay, so they're not covering the homemaker that comes in to help take care of the house. Any of the hands-off stuff, particularly in the home, they are not going to cover any of that cost. And more specifically, what they do cover is they cover the first 20 days. Again, this is following a 3-day prior hospital stay. Medicare will cover the first 20 days in full, 100% of your care. But the next 80 days, days 21 through 100, they will pay the first $204 a day. That's a number that adjusts every single year. The 2024 number is 200. There's a copayment that you as the person receiving the care, has to pay, and that copayment is $204 a day. So that's what you would be responsible for, and then Medicare would cover everything above that. Next, long-term care insurance. Like, I could talk about long-term care insurance for 2 hours, believe it or not. Not that anyone wants to hear that, but but I started my career off working with long-term care insurance and working with a lot of families to help them find the right long-term care insurance policies for them. As a firm, we do not sell insurance, so we do not sell insurance. So what we do is we advise our clients and work with insurance people they may know, or they work with insurance people that we may know. We help them figure out and get the right policies for them. The important thing to know about long-term care insurance is that when I mentioned traditional long-term care insurance, that's the way that long-term care insurance was originally offered, starting back in the 80s. And long-term care insurance was offered, and I'll go through how those policies were set up, and I'll go through it on the right-hand side here. The way it was set up is that the insurance companies will pay a certain amount per year, or per day, or per month towards your care. So one of the things you should do is, if your loved one has a long-term care insurance policy, you're going to want to review that policy to make sure to see exactly how much it will cover. And I'm going to go through some semantics that you're going to read about when you're reviewing that policy. The first is what's called, every policy has an elimination period. This is a deductible period. It's the period of time before the insurance policy will start paying benefits. So it's very common to see a long-term care insurance policy with a 90 or a 100-day elimination period. And the reason why they're set up that way is because Medicare may, if it's skilled care, pay for that first 100 days in part or in full. But you're going to need to know what that elimination period is, and you're going to want to budget maybe for paying that elimination period out of pocket for whatever period of time there is. The next thing you're going to want to look for in a policy is, what's the benefit amount? What's the coverage amount? It's usually in a daily or a monthly amount. So in the example here, I'm using $5,000 a month. That means this policy will pay out up to $5,000 a month to reimburse somebody for, they can either pay directly to the care provider or they can reimburse you, but they won't do it more in this example than $5,000 per month. So you're going to want to know what that maximum benefit amount is. Is it a daily amount or is it a monthly amount? The next thing is a coverage period. The coverage period is the amount of time, the minimum amount of time that policy will pay out that benefit. So a $5,000 per month benefit will pay for at least 4 years. Well, why do you say at least 4 years? Why isn't it just 4 years? Well, the coverage period is used to calculate really the lifetime benefit of the policy. So $5,000 a month might be the benefit amount. You take that $5,000 a month times 12 months, multiply that by the coverage period of 4 years. Mom, dad, or whoever have a $240,000 lifetime pool of money that they can use for long-term care expenses. Now, mom or dad only need $2,500 a month. Maybe that's all it costs them to receive, some non-skilled care in their home. Well, they only draw $2,500 per month. Well, that means that pool of money is going to last more than 4 years. So that's why I say it's a minimum of 4 years. The important thing to know about these long-term care insurance policies is what you really have is you have a pool of money that can be drawn upon at a rate determined by the insurance company. So you're going to want to know what the kind of these different policy provisions are. Now, other things that you should look for in a policy is mom, dad, whoever want to stay in home. The policies may provide a separate amount of money to help you make modifications to your home. Put in a ramp for a wheelchair. Put in
grab bars in the shower.
Grab bars in the shower, accessible, showers, baths, toilets, what have you, to make the home safer and better for for that person. The policy may also have care coordination services. That means the insurance company will pay somebody, a care coordinator, to go and help you figure out what that plan of care is going to be for your loved one. So those are just some things to look at. Interesting side note about long-term care insurance. They don't offer these traditional long-term care insurance policies as much anymore. There's fewer carriers and they're much more expensive than they were a decade ago. And the reason for that has somewhat to do with the financial landscape, low interest rates that kind of put insurance companies in some financial difficulty. But more alarming for you and for all of us is that the actuaries, when they were pricing these policies, drastically underestimated how many people were going to need long-term care and how long they were going to need their long-term care services for. And the reason why that's alarming is that if you weren't fortunate or your loved one was not fortunate enough to get a long-term care insurance policy back when they were more affordable and more prevalent, then that means that you're self-insuring and having to pay, what is a likely event and also for a longer period of time. And you saw what that cost was a few minutes ago. So let's transition now and wrap up with just, really something we do a lot of work with, which is helping families make the most out of those personal assets that they have. Mom, dad, whoever, they have these financial resources. Maybe, they have investment accounts, they have savings, they have a house. And how can we make these last as long as possible to pay for mom, dad, or whoever's care? So here are some, if you're doing this on your own, here are some things that you should do. One, just take inventory of what you have. What do they have? What are those financial resources? Well, what's the cost going to be? We just went through the needs, the wants, and the different areas of where you can receive the care. So create a budget, have an idea of what those costs are going to be. And then you can be a little strategic and thoughtful. And it's important to be strategic and thoughtful to make that money last as long as you need it to. Be strategic and thoughtful for how you withdraw that money. Be strategic and thoughtful from an investment standpoint about how you have that money invested. You don't want mom or dad's investments to go down by 25%. And then all of a sudden you have to pull out $100,000 a year for care. Maybe you lost hundreds of thousands. You saw those account values go down by hundreds of thousands of dollars because of the market. And now you're pulling it down even farther with withdrawals.
And paying taxes on it.
And paying taxes on it. And the taxes are a big thing. So I want to highlight a couple of things related to all of this. So here's, just a sample net worth statement or balance sheet that we create for clients all the time. It's something you can create on your own, through Excel or, maybe software programs that you might have access to. So I mentioned it's important to know what they have. Well, it's also important to know kind of what the tax ramifications are of taking money out of these different accounts. So I try to highlight here some of these different types of accounts. Accounts highlighted in blue, this would just be a regular checking or savings account. There's no, you can take money out of those accounts and don't have to worry about any tax consequences. The same is true about Roth IRAs. Roth IRAs are tax-free withdrawals. That's the real beauty of a Roth IRA. So you need to know how much you have in those tax-free buckets. And then you're going to have on the opposite spectrum, any traditional IRAs, SEP IRAs, 401k plans, 403b plans, retirement plans that you have, through work or you might have set up on your own. Every dollar you withdraw from those plans are going to be taxable as income. So mom or dad need $100,000. Well, if you want to get that full $100,000 to pay for their care out of an IRA, you're probably going to have to withdraw about $130,000, take $30,000 to Uncle Sam, and then to be left with the $100,000 that you need. So being strategic on taking money out of these different buckets of money to monitor and minimize the amount that goes to taxes, to maximize the amount you have to pay for care, that's part of the strategy that you need to be aware of. And I'll go into another kind of strategic example here of something we've done with some clients that is particularly useful in when you're entering into maybe one of those continuing care retirement communities where you have a big lump sum buy-in that you might have. So you have this, in our area, in the DC area, that's, it costs $500,000 to buy into some of these continuing care retirement communities. Well, a portion of that $500,000 is a healthcare expense that's deductible on your taxes, subject to the rules for deducting healthcare expenses. So what we look at is we run, and you have to do this before the end of the year. If you're waiting till you actually file your taxes, it's too late. But in some examples, what we've done is we've taken, an example of someone who has income of $150,000. That's the pension, Social Security. You add it up, it's $150,000. Well, in that year that they bought into that facility, they had a really large medical deductions. Let's just say it totaled $250,000. Their taxes that year, they didn't owe any taxes. They actually showed they had negative $100,000 of taxable income. Well, okay, great. Mom, dad, whoever, they don't owe anything in taxes. Well, that in itself is a good thing, but you can take further advantage of that negative $100,000 because you do not get a refund for that, so you don't get a credit for that, and you can't carry it over. It's not like you sell investments at a loss and you can carry over those losses year after year. You can't carry this loss over. But what you can do, and there's multiple strategies and multiple things you can do in a year like this, but one of the things that we look at doing is, well, what if we create $100,000 of taxable income that we know we're not going to have to pay taxes on because we're working out of this deficit of negative $100,000. So what we did is we converted $100,000 of mom or dad's traditional IRA that is taxable when you take money out of it. We converted we took $100,000 out, and we moved it into a Roth IRA. So, and that creates a $100,000 taxable event, but the $100,000 is offset by the losses. So it created no taxable income. We were able to move $100,000 at no cost to mom or dad from a taxable account to a non-taxable account. And now in future years, so the following year, they need to come up with $100,000 for care. Well, you can take it out of the Roth IRA and not have to worry about any taxes. So it's just important to know what all the tax benefits, what the tax ramifications are of the healthcare expenses you're incurring and how you can best leverage that. Final thing I'll mention here is everybody's concerned about making the money last. You do this, everyone gets really, stressed out about this when you approach retirement. How do I make my money last for the duration of my life while I'm retired and not earning a paycheck? Well, the anxiety kicks up again when mom, dad need to start incurring large healthcare bills. And everyone and they're worried about how long is this money going to last. So it's important to run the analysis, again, yourself with an advisor, to how long can mom and dad afford to pay the cost of care that they're going to need. So again, just an important thing to do. So just to summarize what we talked about over the last, almost an hour, look, it's important to identify what your loved one's needs are. It's important to have those conversations about what their wants are, what's going to make them happy. And then we got to take the reality of the finances in place and how can you pay for them? What is reasonable? What can they afford? And then where do you need to go back and scale back?
Also, some people I know in my generation, were thinking, how am I going to take care of my parents, because they didn't save a lot and they don't have all of these backups. So it's kind of like creating almost like a college fund for your kids. It's like, how am I going to help support my parents? So that's something to talk about with a financial advisor as well.
Yeah, it's forward thinking, it's proactive thinking about whether it's a son or daughter trying to help encourage mom or dad, or doing some financial planning for mom and dad. It's all about planning ahead of time and having those conversations ahead of time. Comes back to conversations. So I want to thank everybody for hanging on. I know we were ran a little longer today. We had a lot to cover. We think it's, this is an important topic. We've enjoyed doing this. This is our third webinar we've done. We've enjoyed doing them for you. I hope you found them helpful. Please check out the prior 2 webinars we've done. Those are available on a YouTube page. Do not hesitate to reach out to us. You have our information here at 4UW Advisors. You can reach out to Fern directly here as well. Fern's books are a great resource. We can, we provide them, our clients going through this situation, they get them in addition to getting access to Fern. Fern, you can reach out, if they can acquire books on Amazon.
Yeah.
Okay, Amazon, best place to get a book.
Barnes & Noble, Walmart, Target, I'm on all of them.
All right, good. So thank you again. Hope you found this to be really helpful. Please do not hesitate to reach out to us to discuss anything specific to your situation, and we're here to help. So with that, thank you again, Fern, and everyone else, enjoy the rest of your day.